On September 22, 2025, President Donald Trump made a stunning and unexpected announcement that sent shockwaves through the nation and the medical community alike. Standing before reporters, Trump claimed that Tylenol, also known as acetaminophen, could be linked to a significantly higher risk of autism when used during pregnancy, a statement that immediately caught the attention of millions of Americans. He urged expectant mothers across the country to stop using the medication, declaring, "Don't take Tylenol, there's no downside." His words were direct, forceful, and left little room for doubt or debate. Trump framed the rise in autism as a national crisis, positioning his administration as finally taking bold, decisive action where previous leaders and health officials had hesitated or failed to act. The announcement, which had been previewed just days earlier at a high-profile memorial for conservative activist Charlie Kirk, was presented as a breakthrough answer to the long-debated question of autism's cause and a promise to grieving families that action would finally be taken. The president's direct warning immediately sparked confusion, anxiety, and even fear, especially among pregnant women who rely on acetaminophen as one of the few pain relief options considered safe during pregnancy. Many began to question what alternatives, if any, were left. By presenting the link as near certain, the administration bypassed the cautious, evidence-based language typically used by public health agencies, setting up a dramatic clash with the broader medical establishment and regulatory bodies like the CDC and FDA. The stage was set for a heated national debate, one that would pit political directives against scientific consensus and force Americans to grapple with questions of trust, evidence, and the role of government in public health. At the press conference, President Trump linked concerns about Tylenol use during pregnancy to his broader skepticism of mainstream medicine, a theme that has defined much of his public health messaging. He questioned the safety of widely used medications, suggesting that the medical establishment often overlooks potential risks in favor of pharmaceutical interests. This narrative resonated with his base, who have grown increasingly wary of expert consensus and government recommendations. Echoing his past doubts about vaccines, Trump drew parallels between the Tylenol debate and previous controversies over childhood immunizations. He implied that just as with vaccines, the public had not been told the full story about the risks of common medications, fueling further distrust in established health guidance. He argued that avoiding Tylenol during pregnancy was a simple, risk-free precaution, framing it as a matter of common sense. However, this perspective ignored the complexities of maternal health, where pain management and fever reduction are sometimes medically necessary. Many expectant mothers were left feeling anxious and confused, unsure whether to trust their doctors or heed the president's warning. Flanked by Health Secretary Robert F. Kennedy Jr. and FDA Commissioner Dr. Marty Makary, both known for their controversial views on medical science, the administration presented a united front. Their presence signaled a deliberate break from mainstream medical opinion, lending political weight to the president's claims. Dr. Makary cited observational studies, such as the Boston birth cohort, and asserted that these studies proved a causal link between prenatal acetaminophen exposure and increased rates of autism or ADHD in children. He referenced data and graphs, presenting them as definitive evidence despite ongoing debate within the scientific community. However, most scientists and medical experts caution that these studies only show correlation, not causation. They emphasize that many factors contribute to neurodevelopmental disorders and that observational research cannot establish direct cause and effect. The scientific consensus remains that more rigorous research is needed before drawing such strong conclusions. The administration's stance, presented as evidence-based and authoritative, was in fact a significant leap beyond what the available data supports. Critics argued that this approach risked spreading misinformation and undermining public trust in science. This approach gave the president's claims a veneer of scientific legitimacy, even as it departed from established medical understanding. The presence of advisors with controversial reputations only deepened the divide between political messaging and scientific consensus. The press conference marked a dramatic shift. Now, the White House was dictating public health policy based on controversial interpretations of science rather than established guidelines. This move set a new precedent for how health information could be politicized at the highest levels. The controversy was immediate and intense, with medical professionals, advocacy groups, and the public all weighing in. The nation was left grappling with confusion and concern as the debate over Tylenol and autism became a flashpoint in the ongoing struggle between science and politics. Alongside the Tylenol warning, the Trump administration announced new federal initiatives on autism. A major autism data science initiative at the NIH would receive millions in funding to investigate environmental causes and treatments for autism. The administration promised to move beyond what it called stagnant research, focusing on unconventional hypotheses, including pharmaceuticals like acetaminophen. The FDA also fast-tracked leucovorin, a folic acid drug, for potential use in treating a subset of children with autism. While experts cautioned that more research was needed, the administration touted this as a breakthrough. Supporters saw decisive leadership. Critics saw politicization of science and a rush to judgment. The administration's multi-pronged plan aimed to show action, but raised concerns about ideology driving research priorities. Health Secretary Kennedy took the stage at a packed press conference, unveiling a sweeping three-part plan designed to address growing concerns about acetaminophen use during pregnancy. The first step was a new FDA physician's notice, warning healthcare providers about the potential risks of prenatal acetaminophen exposure. The second measure called for a prominent black box warning to be added to all acetaminophen products, making the risk impossible to ignore for both doctors and patients. This was a significant escalation in regulatory action, signaling the administration's determination to take visible steps. The third part of the plan was a nationwide public health campaign, aiming to educate families and expectant mothers about the new guidance and encourage safer choices. Together, these steps were intended to directly shape the advice doctors gave to their patients and influence consumer behavior, embedding the administration's position into the very fabric of American healthcare decision-making. Yet, when the FDA released its official statement, the tone was noticeably more reserved. The agency advised doctors to minimize acetaminophen use during pregnancy, but it stopped short of declaring a definitive link to autism or other developmental disorders, citing the need for more research. This difference in messaging revealed a clear tension between the White House's bold, urgent approach and the FDA's more measured, evidence-based assessment. The two institutions seemed to be speaking past each other, each guided by different priorities. The FDA's guidance reflected the ongoing debate and uncertainty within the scientific community, where experts continued to weigh emerging studies and conflicting data. The administration's aggressive, highly visible approach stood in sharp contrast to the FDA's traditional caution, highlighting a fundamental divide in how to communicate risk to the public. The result was a wave of mixed messages, leaving both healthcare providers and the public uncertain about the best course of action and fueling confusion in clinics and pharmacies nationwide. Ultimately, this policy shift was as much about political strategy and public perception as it was about scientific evidence, setting the stage for ongoing debate and controversy. The medical community responded swiftly and critically. The American College of Obstetricians and Gynecologists called the administration's warning irresponsible, emphasizing that acetaminophen remains one of the only safe pain relievers for pregnant women. The Society for Maternal-Fetal Medicine warned that untreated fever and pain pose serious proven risks to mothers and babies. Tylenol's manufacturer, Kenvue, strongly disputed the White House claims, citing comprehensive data showing no causal link to autism. The announcement triggered a sharp drop in Kenvue's stock, highlighting the real-world impact of political statements on public health and business. Experts stressed that the studies cited by the administration were observational and could not prove causation. Many accused the White House of elevating a weak hypothesis to fact, endangering public health for political gain. The administration's claims rest on observational studies that found a correlation between prenatal acetaminophen use and higher rates of autism or ADHD. However, a large 2024 Swedish study of 2.4 million children found no such link, contradicting earlier, smaller studies. A recent Harvard review called the evidence inconclusive and stressed the importance of Tylenol for treating maternal fever. Observational studies can't control for all confounding factors, like the underlying illness that led to acetaminophen use. Most experts agree, correlation does not equal causation, and the evidence isn't strong enough to justify a major change in clinical guidance. The risk of untreated pain or fever is well established, while the risk from acetaminophen remains unproven. The scientific consensus: more research is needed before making sweeping policy changes. The White House warning ignored the dangers of not treating fever or pain during pregnancy. High fevers, especially in the first trimester, are linked to serious birth defects and pregnancy complications. Untreated fever can cause miscarriage, stillbirth, and preterm labor, while severe pain increases stress and risks for both mother and baby. Acetaminophen is the primary recommended treatment, as alternatives like ibuprofen are unsafe in pregnancy. Forcing women to avoid Tylenol could lead to worse outcomes than the speculative risks the administration highlighted. Medical organizations argue that the benefits of acetaminophen far outweigh any unproven risks. The president's advice, they say, was dangerously incomplete. The conflicting messages have left many expectant parents confused and anxious. On one side, a presidential warning; on the other, decades of medical guidance supporting acetaminophen's safety. In this environment, the best course is to rely on personalized advice from qualified healthcare providers. Every pregnancy is unique, and only a doctor or midwife can weigh the risks and benefits for each patient. Medical decisions should be made in consultation with professionals, not based on headlines or political statements. Open, honest communication with a trusted provider is essential for navigating complex health choices. Ultimately, individualized care, not sweeping proclamations, should guide decisions during pregnancy. Tylenol's sudden politicization has created confusion for millions. The administration's warnings clash with scientific consensus, thrusting an unresolved question into the public spotlight. While some studies suggest a correlation, no causal link has been proven, and the risks of untreated fever or pain are well documented. Experts warn against making health decisions based on political rhetoric rather than evidence. For pregnant women, the key is to consult with medical professionals and consider the full context. The Tylenol controversy highlights the dangers of presenting scientific uncertainty as fact. In the end, personal health decisions should be grounded in science and guided by trusted experts, not politics.